Since 1853, the Maine Medical Association has served the interests of physicians. This is a documentary looking at how members of the Maine Medical Association participate within the organization and how the MMA participates politically.
The purpose of the association, its mission, hasn't changed that much in 160 years. We advocate for physicians and their patients and the health of the public.
The association's main goal is to be the premier healthcare organization recognized by all doctors and the public as the leader and the voice of the physician community. The MMA currently has about 4,000 members, with about half considered to be active members. The association benefits from its staff advocacy work as well as the strength and engagement of its volunteer members.
Medicaid expansion is huge right now. In Washington, Medicare, because there's another 20% reduction coming unless we change the formula.
What can we do to help with the major issues that are impacting health of the citizens and health care in the state? So obesity, inactivity, access to food, reasonable housing, a whole range of things. They can be an articulate voice for that kind of work.
Access, the cost of medical care. We're right now down there negotiating a bill that will require physicians to post their prices that they would charge to an uninsured patient, because that's a good way to get patients to pay more attention to the cost of things. So many of our activities relate to advocacy in some way. We have a political action committee. We're very engaged with candidates. We'll be in Washington next week on Tuesday and Wednesday down there. Probably half of what we do here relates to advocacy. The other, and even the things that we don't do that are beyond advocacy, still promote the goals of helping physicians and patients and the public health.
The MMA's membership consists of physicians, residents, and medical students. The total membership is about 4,000 people, and becoming a member is quite simple.
There is a great deal of diversity now. There didn't used to be, I would say. I think 40 or 50 years ago, most of the physicians were male, white, trained in this country. Now we have quite a bit of diversity. Half of our members will be women. There's not much question about that eventually. Once you establish that they're all physicians, it's quite diverse.
The MMA's membership is made up of only doctors, but the association serves the interests of the patients and the overall health of Maine citizens. As a nonprofit, nonpartisan organization, the MMA has supported bills for general health of Maine citizens, including issues on cigarettes and childhood obesity.
Well, we provide a lot of services to physicians. We have 3 attorneys here, so we give them a lot of advice. We're also the lobbyists, and we would consider what we do at the State House every day to be a service.
It was also education, it was outreach, it invited younger physicians, older physicians into the mix.
They can call here any day, and some of them do call every day practically.
What they have done has changed. It used to be a formal newsprint, then it got to be a website, then it got to be periodic releases, print and email. You can sign up for updates. So I think they've been pretty flexible about how they get that out there. And for a bunch of doctors, they're kind of flexible with social media.
We do a lot of education.
They were a resource for information and helped me understand what they were trying to do and make sure that what I was doing was counting. Gave me an opportunity to be the doc of the day up in the legislature, which gets you some good press for providers. Providing support for providers who are struggling with mental health and substance abuse issues. And they've been a very reliable, very respected resource for that kind of work. So that alone gives them top honors in my book.
The more you get involved, the more you realize just how genuine they are with their concerns, which doesn't always make it to the press. But I think that Gordon does a great job of conveying that message when he's dealing with the press.
They don't get nearly as engaged as they should.
Maine Medical Association has approximately 4,000 members, but only about half of these members are considered active.
1,000 people who consider themselves active. That's pretty good for a group of that size.
We try to light a fire under them, and but we're competing too. We're competing with their time devoted to their specialty. We're competing with their family time. And now we're competing with their personal time.
I think they have a lot of credibility built up over the years. So if they were to take a position on something, I'll rephrase that, when they do take a position on something, they are a group that gets listened to. It's not as if they're way on the left or way on the right. They have enough diversity of opinions that they find their way to the middle.
Saw what was going to happen with Obamacare and didn't just fall by party. They fell by what was best for people here, and they didn't just throw it under the table. They said there were good things, there were some things that weren't so good, but overall I think they felt was a great move for medicine and for healthcare in the state of Maine.
Looking forward, the MMA continues to maintain its focus on providing the best health for Maine citizens. They have started a program to help pay for med students' tuition to ensure they return to practice medicine in Maine. They also include med students in their organization, with hopes that students' opinions will help the organization continue to focus on the most important issues in medicine. The organization maintains the focus that serving physicians' interests is the forefront of their aims through its lobbying and advocacy.